Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, causes and treatments for a bruised toenail. A bruised toenail is also known as a subungual hematoma, which is blood and fluid trapped beneath the toenail. This gives the toenail a red, black, or purple discoloration. It is often called black toenail for that reason. /r/n/r/n A subungual hematoma is usually caused by repeated trauma and is common in athletes. A subungual hematoma may also happen when a heavy object hits the toe. Most of these injuries can be managed at home, but you may need to see a healthcare provider if your injury is severe or if you have underlying health problems. /r/n/r/n Verywell, Jessica Olahrnrn A subungual hematoma occurs when blood becomes trapped under the nail. When blood pools up beneath the nail, it can appear red, blue, black, or purple. /r/n/r/n The appearance of a subungual hematoma can range from a small, dark spot under the nail to a large area of discoloration. It can happen to toenails or fingernails. /r/n/r/n Symptoms of a subungual hematoma can change as the blood builds up and more pressure is felt. Here's what you can expect. /r/n/r/n While the nail may fall off, often, it stays intact, and the blood fades as it grows out. /r/n/r/n This video has been medically reviewed by Chris Vincent, MD.rnrnR/n/r/n A bruised toenail is usually caused by some kind of trauma. It may happen when something falls on the toe, or it may happen because of repeated irritation over time, such as the nail rubbing against footwear. /r/n/r/n A black toenail can be caused by malignant melanoma, cancerous cells, fungal infection, chronic ingrown nails, or diabetes.rnrn The more active you are, the more you may be at risk for a subungual hematoma. However, other factors can increase the chances you develop this problem, including /r/n/r/n To determine if discoloration and pain are due to a subungual hematoma, your healthcare provider will examine the toenail and ask you questions about recent trauma, exposure to factors such as moisture, or behaviors that could cause problems such as picking at toenails. /r/n/r/n If the condition seems severe, your provider may order X-rays or blood tests. This can help them see if there is a broken bone or infection contributing to the condition. /r/n/r/n Most subungual hematomas can be managed at home. If less than half of your nail is black and it is not causing any pain, you may not need to do anything to treat it. The nail may fall off on its own or simply grow out over time. /r/n/r/n If your toenail is painful, you can treat it with conservative therapies such as the following. /r/n/r/n After an injury, the nail bed can take between 7 to 10 days to heal. However, if the injury was severe, the entire toenail itself may need 12 months to regrow. A lost fingernail can take between 4 to 6 months to grow back. This may take less time if the injury is minor./r/n/r/n If a subungual hematoma covers more than half your nail and is causing pain, medical treatment may be needed to drain the blood and relieve pressure under the nail. A large hematoma can be a sign that you have a subungual laceration. /r/n/r/n If left untreated, a subungual hematoma or laceration could damage the nail matrix, the area from which the nail grows, causing it to grow incorrectly or not at all. These changes could be permanent. /r/n/r/n If the nail is raised or cut, it could also increase the risk of a fungal or bacterial infection. /r/n/r/n It is especially important to see a healthcare provider for the following. /r/n/r/n If you are unable to see a healthcare provider right away, bandage the nail and avoid trimming or cutting it. /r/n/r/n If you have diabetes, managing your condition can help improve symptoms such as a discolored nail. Because unmanaged diabetes can cause a number of dangerous complications, it is important to be evaluated by a healthcare provider if there's a chance diabetes might be causing your symptoms. /r/n/r/n If your nail is mostly or completely black, you might have a subungual laceration, tear or cut, which will require medical treatment. If your nail is raised and the injury happened less than 48 hours earlier, your healthcare provider may drill a hole to help drain blood and reduce pressure. If it is loose, the nail may be trimmed or even reattached to protect the nail bed while the nail is regrowing. /r/n/r/n If your injury is severe or the nail is separating from your toe, your healthcare provider may decide to remove the nail. /r/n/r/n You should avoid removing or drilling the injured nail yourself at home. Doing so could lead to infection and slow the healing process. /r/n/r/n Nail damage may lead to changes in the nail's structure. These changes may occur after an injury from a heavy object, chronic rubbing against the shoe, or in response to irritation from infections. /r/n/r/n Some of the most common changes in nail structure are /r/n/r/n Since subungual hematomas are caused by injury, avoiding repeated stress on the toenail and situations where injury to the toes is possible can help you prevent them. For example, /r/n/r/n Bleeding beneath the nail can happen after an injury, such as a heavy object landing on the toe or from chronic rubbing within your shoes. If it covers a large area of the toe or is painful, medical treatment may be needed to relieve pressure and help prevent permanent nail changes. /r/n/r/n Sometimes bleeding under the nail can change the structure of the toenail for a period of time and may lead to the nail loosening or falling off. This is usually temporary, but if the trauma was severe, it may be permanent. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.